Hello guys, I'm back. My name is Carlene Joseph. I am a nurse practitioner. We thank you for checking the channel. And again, if you're new, go ahead and subscribe, like the video. And if you feel that it's really helpful, send to others, and especially those that are in school or that do injections at home on their own. So today, my previous video was about intramuscular, right, going into the muscle. Today, I'm going to talk to you about sub-Q, and I'm going to teach you how to do a subcutaneous injection. Sub-Q meaning it's going in the fat, right? You have different areas you can do it. There's some fat in your thighs. There's some fat in your stomach. You have fat in the back of your arm. But today we're going to do the sub-Q in the stomach area, lower abdomen to be precise. And you know, there's different medications you can put sub-Q, subcutaneous. You can do insulin, you can do GLP-1 injections. There's different things, heparin, anticoagulants. There's a lot of sub-Q injections you can give. So today I'm giving myself a tricipitide. I'm using that weight loss program. So far I've lost, I would say, because I was 253 and now I am 206. And I started about last August. So it's less than a year. And I have great results. I love it. I could improve more, to be honest, because I need to increase with my exercise. And my diet is horrible. My water intake is terrible. So a lot of things I can do. So let's not go off subject. But that is what I'm using today, the tricipitide injection. I'll be giving that. And remember, you always have to have your sharp container. If you're giving for someone else, you use your gloves, right? Hand hygiene, I can't express. Wash your hands, right? And put on your gloves for if you're giving to someone else. But if it's yourself, you don't really need it. You will need a sub-Q needle. They're really small. They're not as big as the intramuscular, because when we're going into the fat, you don't want to pierce through the fat and go elsewhere. So it's a really small needle. It's really mostly used with insulin use for type 1, type 2 diabetes if they're on insulin. Today we will be doing the subcutaneous tricipitide, okay? And I will be using the, first you'll need a sub-Q needle. You will need alcohol swab, your medication. And remember I told you, if you have the medication from the pharmacy and it does not have the cover on it, you need to return it. It has to have the cover on it, right? And of course, hand hygiene, your needle. So you will open, right? You will open your medication. Remember we did our hand hygiene, right? You will prepare your medication by taking off the little cap, stopper off the insulin syringe, right? And you will go ahead and put in the whatever amount of medication you're taking out, you put that much of air in that syringe. So if you're taking out 10 units, 20 units, however amount of medication you're taking out, you put that amount of air into your syringe. And so you're going to insert the air into the medication. Of course, remember I taught you, you take off the cap, right? You insert your needle into the medication, right? And you invert the bottle. That way you're able to withdraw. You're going to push in the air that you want to take out. And as you do that, you withdraw your medication, right? Remember, try not to get any air into your syringe. And if you do, all you have to do is push it back in, because remember the medication, it's clean. The needle hasn't gone anywhere else, so it's clean. So you push back whatever medication that you have, right? Once you're all done, right? You're all done. And if you have any excess air, just go ahead and flick it. Once you flick it, the excess air will come out, right? You have your alcohol pad. You're gonna wipe the area where you want to give the medication. So me, I'm gonna use my lower abdomen. You can use your thigh, you can use your arm, however, but today I'm teaching you to in your lower stomach area, lower abdomen. Okay, so here you go. You clean the area, right? You clean the area with your alcohol. And again, you insert the needle right? You insert the needle. Once you're in, then you push the medication in. Okay? The medication is in. Easy peasy. All done. All done. You don't need to wipe. You don't need to massage. You don't need to do anything because remember, it's in your fatty area subcutaneous. And you put your needle in your sharps container. Don't recap. Never recap. Put it in your sharp container. Done. So if you liked the video, if it was helpful, go ahead, put a like, share, all right, subscribe, and put on your notification. That way, anytime we have a new video coming out, you will be the first to be notified. Okay?